Swayam Prabha. Digital India. Educated India.
Hello learners, I am Dr. Rekha Sharma, Professor UGC Human Resource Development Center, Rashtrasant Tukaroji Maharaj Nagpur University, Nagpur. In this video, we shall study water-soluble vitamins. Now the learning objectives. After studying this module, the students shall be able to describe the functions of water-soluble vitamins, identify their food sources, discuss effects of deficiency or excess, and state recommended dietary allowances. Now, what are these water-soluble vitamins? The water-soluble vitamins are the B complex group and vitamin C. Scientists discovered 11 water-soluble B complex vitamins, of which 8 are considered essential for humans. They differ from each other in their structure, distribution in foods, stability, and symptoms that result from their deficiency. Water-soluble vitamins dissolve in water and are not stored. They are eliminated in urine. Hence, we need a continuous supply of these vitamins in our diets. Being water-soluble, the B complex and C vitamins are readily absorbed from the different regions of the small intestine. Water-soluble vitamins are easily destroyed or washed out during food storage and preparation. Hence, proper storage and preparation of food is important, which can minimize vitamin loss. Now let us study what are these B complex vitamins. They are thiamine or vitamin B1, riboflavin or vitamin B2, niacin, pyridoxine or vitamin B6, folic acid or vitamin B9, pantothenic acid, biotin, cyanocobalamin or vitamin B12, para-aminobenzoic acid or PABA, inositol, and choline. Now, first 8 vitamins are grouped together because their functions are closely related. The remaining 3 B complex vitamins, namely para-aminobenzoic acid, that is PABA, choline, and inositol, play an active role in cell metabolism, but the diet and intestinal synthesis can make good this requirement. The B complex vitamins, which are essential in human nutrition, are broadly grouped into 3 categories. They are: first is classic deficiency disease vitamins, that includes like deficiency of thiamine leads to beriberi, riboflavin leads to a riboflavinosis, and niacin leads to pellagra. Second group is anemia preventing vitamins like pyridoxine. Deficiency of pyridoxine leads to hypochromic anemia. Deficiency of folic acid leads to macrocytic anemia, and deficiency of cyanocobalamin leads to pernicious anemia. Third group is coenzyme factors like pantothenic acid and biotin. They act as coenzymes. Now let us study these vitamins one by one. Thiamine, that is vitamin B1. Now let us study the functions of thiamine or vitamin B1. Thiamine performs the following functions. Thiamine functions mainly as a coenzyme, that is thiamine pyrophosphate or TPP, which is required in the breakdown of glucose to yield energy. It helps to maintain a healthy nervous system. It is required for normal appetite and digestion. Now the sources of thiamine. Foods rich in protein such as pulses, groundnut, pork, liver, and eggs are good sources. Whole grain and enriched cereals, parboiled rice, unpolished rice, and sprouted pulses contribute vitamin B1. Soybean is a rich source. Now, what is the effect of cooking and processing on thiamine? Vitamin B1 is easily destroyed by cooking food in neutral or alkaline medium. Losses are greater when food is cooked at higher temperatures, overcooked, and cooking water is discarded. Now, deficiency of thiamine. Thiamine deficiency causes the disease beriberi. Two forms of beriberi, namely wet beriberi and dry beriberi, occur in adults. Infantile beriberi affects infants. Beriberi is also known as rice eater's disease because it is seen in people whose chief diet consists of polished rice. Now, the symptoms of this disease. The early clinical features are common to wet and dry beriberi. The first symptoms are anorexia and dyspepsia associated with heaviness and weakness of the legs. There is tenderness of the calf muscles on pressure with complaints of pins and needles pain and numbness in the legs. The subject feel weak and get easily exhausted while working. If not treated, the subjects may develop wet or dry beriberi. Now we will study the symptoms of wet and dry beriberi. Now, symptoms of wet beriberi. Edema is the important feature of wet beriberi. It may develop rapidly and involve not only the legs but also the face, trunk, and serous cavities. Palpitation and breathlessness are present. The calf muscles are frequently tense, slightly swollen, and tender on pressure. The veins of the neck are distended and show visible pulsations. The diastolic blood pressure is low and systolic is high. The pulse is fast and bouncing. The heart becomes weak and death occurs due to heart failure. Now the symptoms of dry beriberi. Early symptoms are similar to those found in wet beriberi. The muscles become progressively wasted and weak and walking becomes difficult. The emaciated subject needs the help of sticks to stand and walk and finally becomes bedridden. If not treated, the patient will die. Now, infantile beriberi. Infantile beriberi is commonly seen in many Southeast Asian countries where the diets consist mostly of polished rice and are deficient in thiamine. The occurrence of beriberi is due to first, inadequate thiamine intake related mainly to poor thiamine content of breast milk, and second, consumption of over milled rice deficient in thiamine by the mother. Now, infantile beriberi. Two types of infantile beriberi are known. These are cardiovascular type and neuritic type. The cardiovascular type, or it is similar to wet beriberi, it manifests itself in babies between the ages of 2 and 4 months. The onset is acute with classical signs and symptoms of congestive cardiac failure, tachycardia, dyspnea, enlargement of the heart, elevated venous pressure, enlarged tender liver, edema, and oliguria. The neuritic or cerebral beriberi shows typical manifestations of peripheral neuropathy, tenderness of calf muscles, and diminished tendon jerks. Now, toxicity of vitamin B1, that is thiamine. Thiamine toxicity is not a problem because renal clearance of the vitamin is rapid. Since the body stores of thiamine are very low, we must ensure adequate daily intake. Now, recommended allowances of thiamine. Thiamine requirements for adult male of different activities range between 1.4 to 2.3 milligrams per day, and for females from 1.4 to 2.2 milligrams per day. An additional allowances of thiamine has been made for pregnant and lactating women based on the additional calorie allowances of recommended dietary allowances 2020. Now, riboflavin or vitamin B2. Now, functions of riboflavin. Riboflavin, a water soluble vitamin, was discovered in milk as a pigment possessing a yellow-green fluorescence as early as in 1879. However, its role in our body was identified much later. Now, as a coenzyme, just like vitamin B1 is a vital factor in carbohydrate metabolism, vitamin B2 is vital in protein metabolism. As a coenzyme in carbohydrate metabolism, vitamin B2 is a constituent of coenzymes flavin mononucleotide FMN and flavin adenine dinucleotide, that is FAD. Now, sources of riboflavin. Milk and cheese are rich in vitamin B2. Organ meats, eggs, dark green leafy vegetables and enriched cereal foods are good sources. Now, effects of cooking and processing on riboflavin. Vitamin B2 is sensitive to light. If milk is kept in clear glass bottles, 3/4 of vitamin B2 is lost in a short time. Cooking in open containers and in excess water is harmful. Now, deficiency of riboflavin. Riboflavin deficiency results in the condition of hyporiboflavinosis or ariboflavinosis with sore throat, hyperemia, that is condition in which the blood collects in a part of the body, edema of the pharyngeal and oral mucous membranes, cheilosis, that is cracking of the corner of the mouth, angular stomatitis, that is inflammation at the corner of the mouth, glossitis, that is inflammation or the infection of the tongue, seborrheic dermatitis and normochromic normocytic anemia associated with pure red cell cytoplasia of the bone marrow. As riboflavin deficiency almost invariably occurs in combination with the deficiency of other B complex vitamins, some of the symptoms, that is glossitis and dermatitis, may result from other complicating deficiencies. Now, recommended dietary allowances for riboflavin. Recommended dietary allowances for adult men is 2.0 to 3.2 milligrams per day, and for adult women it is 1.4 to 2.2 milligrams per day for different levels of activities. And additional allowances of riboflavin has been made for pregnant and lactating women based on the additional calorie allowances of recommended dietary allowances 2020. Now, niacin. Now, niacin or nicotinic acid is a vitamin intimately connected with several metabolic reactions it takes part in as a component. Like vitamin B1 and B2, niacin is also required for enzymes that bring about breakdown of glucose, amino acids and fatty acids to yield energy, that is for release of energy from food. Now, functions of niacin. As a constituent of two coenzymes, nicotinamide adenine dinucleotide, that is NAD, and nicotinamide adenine dinucleotide phosphate, that is NADP, to release energy from carbohydrates, proteins and fats. It is also important for a healthy skin, normal gastrointestinal tract and maintenance of the nervous system. Now, sources of niacin. Protein-rich foods such as poultry, fish, meat, groundnut, beans and peas are good sources. Grains are fair sources except maize and rice. Green leafy vegetables, potatoes, milk, eggs and cheese are poor sources of pre-formed niacin, but they are rich sources of tryptophan. Now, effect of cooking and processing. It is most stable of all B complex vitamins. It is fairly stable to heat, acid, alkali, light, oxidation and autoclaving. Now, deficiency of niacin. Niacin or nicotinic acid deficiency classically results in pellagra. It is seen in low protein or maize based diets. Pellagra, which means rough skin, is characterized by 4 Ds, that is diarrhea, dermatitis, dementia and ultimately death. Deficiency begins with weakness, headache, loss of appetite and weight, and a sore and swollen tongue. Dermatitis is symmetrical and on exposed parts of the body like forearms, legs and hands, and is aggravated by sunlight. Dementia or depression, confusion, poor memory, delirium, and hallucinations occur in severe deficiency. Without treatment, it results in death. Now, recommended dietary allowances for niacin. Because this vitamin takes part in many reactions of energy metabolism in the breakdown of proteins, carbohydrates, and fats, its requirement is related to calorie intake, which is about 6.6 mg per 1000 kilocalories. Although milk is not a good source of niacin, it contains essential amino acid tryptophan, which is converted to niacin in the body. 60 mg of tryptophan is equal to 1 mg of niacin. Now, recommended dietary allowances for niacin. The recommended dietary allowance for adult men is 14 to 23 milligrams per day, and for adult women it is 11 to 18 milligrams per day. Additional allowances of plus 2 and plus 5 milligrams per day niacin has been made for pregnant and lactating women respectively based on additional calorie allowances of recommended dietary allowances 2020. Now, anemia preventing vitamins. Folic acid, vitamin B12 and vitamin B6 help in the formation of either red blood corpuscles or hemoglobin and help in preventing anemia. Now, folic acid or folacin are also known as vitamin B9. Folic acid or folate is a generic term which includes naturally occurring food folate and folic acid in supplements and fortified foods. It derives its name from Latin word folium, which means leaf. Now, functions of folic acid. Folic acid is a component of specific enzymes required for formation of DNA and heme in the red blood corpuscles. Vitamin B12 is required along with folic acid for maturation of red blood corpuscles. In order to perform its functions, folic acid needs to be converted into its active form. Vitamin C is needed for this conversion. So, inactive folic acid is converted into active folic acid with the help of vitamin C. Folate is also important for pregnant women. Low blood levels of folate during pregnancy can cause neural tube defects, that is anencephaly, a defect in the closure of the neural tube, and spina bifida, a congenital defect in which the spinal column is imperfectly closed so that part of the meninges or spinal cord protrudes, often resulting in hydrocephalus and other neurological disorders. And people with anemia or at risk of anemia need to be sure they consume enough folate as well. Now, sources of folic acid: liver, kidney, green leafy vegetables, whole pulses and yeast, and fermented foods such as idli, dokla and dosa are rich sources of folic acid. Some bacteria present in the intestinal tract are capable of synthesizing the vitamin. Now, deficiency of folic acid. Deficiency results in megaloblastic anemia, which is common in underdeveloped countries among the vulnerable age groups. In folic acid deficiency, the bone marrow releases large nucleated cells into the circulation. The anemia is a megaloblastic anemia. Megaloblasts are large nucleated cells or immature red blood corpuscles. Hemoglobin level may fall as low as 2 to 4 gram per 100 ml and blood transfusion may be needed. Other symptoms are weakness, loss of weight, pallor and glossitis. Normal hemoglobin level is 11.5 to 14.5 grams per 100 ml for women and 12.5 to 16.5 grams per 100 ml for adult men. Now, pregnant women are at a risk of developing folate deficiency because of increased demand for folate. Impaired folate status is associated with increased risk of preterm delivery, infant low birth weight, and fetal growth retardation. During pregnancy, there is an increased risk of fetal neural tube defects, that is NTDs, with risk increasing tenfold as folate status goes from adequate to poor. Between days 21 and 27 post conception, the neural plate closes to form what will eventually be the spinal cord and cranium. Spina bifida and encephalopathy and other similar conditions are collectively called NTDs. They result from improper closure of the spinal cord and cranium respectively and are the most common congenital abnormalities associated with folate deficiency. Now, recommended allowances of folic acid. Recommended dietary allowance was calculated as 300 micrograms for adult men and 220 micrograms for adult women. Additional requirements of 350 micrograms per day and 110 micrograms per day have been added respectively during pregnancy and lactation for meeting the extra needs. Now, cyanocobalamin or vitamin B12. Now, functions of cyanocobalamin or vitamin B12. It helps folic acid in the synthesis and maturation of red blood corpuscles. It is essential for formation of myelin sheath around the nerve fibers. It is essential for the metabolism of fats and carbohydrates and the synthesis of proteins. Now, sources of cyanocobalamin or vitamin B12. It is found only in foods of animal origin. Liver, kidney, milk, eggs and cheese are good sources. Small amounts of animal proteins in the diet take care of B12 requirement. Now, absorption. Now, it is very important that vitamin B12 is absorbed only if a glycoprotein known as intrinsic factor is present in gastric juice. Now, deficiency of cyanocobalamin. Vitamin B12 deficiency results either in megaloblastic anemia or in pernicious anemia. The latter is more common and is serious. Megaloblastic anemia seen in strict vegetarians who do not consume milk. It is because of a dietary deficiency of vitamin B12. Pernicious anemia occurs due to absence of intrinsic factor in the person's gastric juice. So, even if diet provides enough vitamin B12, it will not be absorbed. The person appears well nourished with respect to body weight. Skin and eyes are pale, tongue is raw and red, and mouth ulcers are present. There is numbness, tingling sensation, and a feeling of pins and needles in the fingers as nervous system is affected. Hemoglobin level is low and megaloblasts appear in blood. Treatment of pernicious anemia involves injections of vitamin B12 throughout life as oral doses cannot be absorbed due to lack of intrinsic factor. Now, recommended dietary allowances of vitamin B12. Vitamin B12 deficiency is common in true vegans who can be treated with small doses since the daily requirement is only 2.2 micrograms per day. However, the requirements do increase in pregnancy by plus 0.25 micrograms per day and lactation by 1 microgram per day. Now, next is pyridoxine or vitamin B6. Now, functions of pyridoxine. It is essential for synthesis and breakdown of amino acids. It helps in conversion of tryptophan to niacin. It is needed for conversion of linoleic acid to arachidonic acid. It is needed for synthesis of heme. It is also needed for production of antibodies. Now, sources of pyridoxine: liver, kidney, meat, whole grains, soya beans, and groundnuts are sources of pyridoxine. Now, deficiency of pyridoxine. Anemia is hypochromic anemia because hemoglobin is not synthesized for the red color of red blood corpuscles. Red blood cells are pale in color. Soreness of tongue, depression, and sleepiness are other symptoms. Deficiency occurs along with other nutrient deficiencies, for example, protein calorie malnutrition and B complex deficiency. Now, recommended dietary allowances of pyridoxine. Recommended dietary allowance of 1.9 milligrams per day of pyridoxine has been suggested for adult men and women. The requirement increases with an increase in protein content of diet. Now, pantothenic acid and biotin. Pantothenic acid and biotin, they are both coenzymes required for release of energy from carbohydrates, fats, and proteins. Biotin is synthesized in the intestinal tract. Both vitamins are widely present in foods and deficiency is rare in normal circumstances. Egg white contains a protein avidin that interferes with the absorption of biotin from the intestinal tract. Only raw egg whites can cause a deficiency as avidin is inactivated when eggs are cooked. Now we have studied about 8 different vitamin B complex vitamins. Now we shall study vitamin C. Vitamin C, also known as the fresh fruit and vegetable vitamin, was discovered as an acid in lime juice which prevented scurvy among British sailors on long voyages at sea. It was named ascorbic acid because of its anti-scorbutic or anti-scurvy properties. It is highly soluble in water and most easily destroyed as compared to all other vitamins. It is readily oxidized and destroyed by heat and presence of alkali. It is lost when food is dehydrated. Now, functions of vitamin C. It helps in synthesis of collagen, which is the intercellular cementing substance that keeps cells in bone and muscle tissue together. It helps in synthesizing hemoglobin by helping in absorption of iron from food. It helps in healing of wounds and fractures. It helps in increasing resistance to infections and fevers. It helps in proper growth during periods of increased need or during rapid growth. It is an antioxidant like vitamin E. It prevents the oxidation of unsaturated fatty acids. Now, deficiency of vitamin C. Deprivation of vitamin C results in defective formation of the intercellular cementing substance. Severe ascorbic acid deficiency results in the development of the disease known as scurvy. Now, there are two types of scurvy, adult scurvy and infantile scurvy. Now, the symptoms of adult scurvy. General weakness. The first symptoms are weakness, easy fatigue and listlessness. These are followed quickly by shortness of breath, pain in bones, joints and muscles of the extremities. Then swollen and tender joints and hemorrhages in various tissues. Hemorrhages occur deep in muscle, particularly in calf, thigh, buttocks and forearm, causing pain in surrounding tissues. The most specific sign includes the hyperkeratotic hair follicle with a hemorrhagic halo. Hemorrhages may also occur in joints, causing swelling and pain. Now, the very important symptom of scurvy is bleeding gums and loose teeth. As ascorbic acid deficiency advances, the gums become swollen, blue-red, spongy, and very friable. They may become infected by bacteria. The teeth loosen in the alveolar bone. Now, infantile scurvy. In infantile scurvy, the changes are mainly at the sites of most active bone growth. Characteristic signs are pseudoparalysis of the limbs caused by extreme pain on movement and hemorrhages under the periosteum, as well as swelling and hemorrhages of the gums surrounding erupting teeth. Now, sources of vitamin C. Fresh citrus fruits such as orange, sweet lime, grapefruit, lemon. Other fruits and vegetables such as guava, amla, cabbage, capsicum, green chilies, green leafy vegetables, and tomatoes are excellent sources of vitamin C. Cereals and pulses are poor in vitamin C, but when dry pulses are sprouted, ascorbic acid is formed in them. 85% of the vitamin is formed in the grain and 15% in the sprout. Green gram contains thrice as much vitamin C as compared to Bengal gram. Sprouted pulses are a good alternative to fresh fruits and vegetables during periods of scarcity. Sprouts can be lightly steamed or consumed raw. Berries such as ziziphus, that is bear, strawberries, gooseberries, and cashew fruit are seasonal rich sources. Amla is the richest source, providing 600 milligrams per 100 grams as compared to oranges, which provide 30 milligrams per 100 grams. That is, amla contains 20 times as much vitamin C as compared to orange. Heating and dehydration reduce the vitamin C content of all fresh fruits except amla, which retains some vitamin C in the preserve. Now, recommended allowances of vitamin C. The recommended daily allowances for ascorbic acid for adult male is 80 milligrams per day and 65 milligrams per day for females. Due importance of ascorbic acid in a meal to improve iron absorption among Indians on a vegetarian diet is also emphasized while making the recommendations in Recommended Dietary Allowances 2020. An additional allowance of plus 15 milligrams per day for pregnant mothers and plus 50 milligrams per day for lactating mothers have been recommended in RDA 2020. Now let us see the effects of excessive intake of vitamin C. The benefits of consuming mega doses of vitamin C to prevent the common cold and cancer is still controversial. An increased intake beyond the recommended dietary allowances is advised in certain cases such as surgical cases, infections and drug therapies, but benefits of mega doses of 1 to 5 grams daily is still under study. Now this table will show you the recommended dietary allowances and main sources of water soluble vitamins. Now first is thiamine. The recommended dietary allowances for thiamine for men is 1.4 to 2.3 milligrams per day for men and 1.4 to 2.2 milligrams per day for women, and the main sources are whole grains, pulses, wheat and groundnuts. Now riboflavin or B2, the recommended dietary allowances are 2.0 to 3.2 milligrams per day for men and 1.9 to 3.1 milligrams per day for women, and the main sources are milk, eggs and organ meats. Now niacin and provitamin tryptophan, the recommended dietary allowances are 14 to 23 milligrams per day for men and 11 to 18 milligrams per day for women, and sources are all protein rich foods, groundnuts, beans, peas, meat and fish. Pyridoxine or B6, the recommended dietary allowances are 1.9 to 3.1 milligrams per day for men and 1.9 to 2.4 milligrams per day for women, and the main sources are wheat, jowar, red gram, meat, liver, fish, and parboiled rice. Now, pantothenic acid, the recommended dietary allowance is 5 milligrams, and the main sources are milk, egg, and intestinal flora. Biotin, the recommended dietary allowance is 40 micrograms, and the sources are intestinal flora, egg yolk, and liver. Folic acid, the requirements are 300 micrograms for males and 220 micrograms for females, and the main sources are green leafy vegetables, lentils, intestinal synthesis. Cyanocobalamin or vitamin B12, the requirement is 2.2 micrograms per day, and the sources are milk and milk products. Then finally, ascorbic acid or vitamin C, the requirements are 80 milligrams for men and 65 milligrams for women, and the sources are fresh fruits and vegetables, eaten and uncooked, and citrus fruits. Now let us summarize. The B complex vitamins are water soluble and include 11 vitamins, namely thiamine or vitamin B1, riboflavin or vitamin B2, niacin, pyridoxine or vitamin B6, folic acid, cyanocobalamin or vitamin B12, pantothenic acid, biotin, choline, inositol, and para-aminobenzoic acid. They mainly function as coenzymes in the release of energy from carbohydrates, fats, and proteins. 3 B complex vitamins are designated anemia preventing vitamins as they are needed for synthesis of heme and for the maturation of red blood cells. Apart from the food sources, the bacterial flora in the intestine are capable of synthesizing vitamins, namely vitamin K and B complex vitamins. Vitamin C is the most susceptible of all vitamins. It is present in fresh fruits and vegetables and in sprouted grains. It is destroyed by oxidation, heat, and an alkaline medium. Proper cooking practices need to be followed if vitamin content of food has to be retained. These are references. With this, we have finished our topic on water soluble vitamins, vitamins part 2. Thank you.